What if the reason that you're not getting pregnant has nothing to do with your ovaries and everything to do with your gut? So, if you're somebody who may have yeast overgrowth, bacterial imbalances, parasites, or just overall chronic gut inflammation, that all can actually disrupt your estrogen, your metabolism. It can create a dysregulated immune system, it'll increase inflammation levels, and it can absolutely interfere with conception and your fertility journey. And most OBs do not look here. So, today I'm going to walk you through exactly how your gut health impacts fertility, why infections and overgrowth matter so much more than you may realize, and why running a comprehensive stool test during that preconception period is really ideal in that year prior to trying to conceive, or at least several months in advance. Because when we talk about preparing for pregnancy, we're not just talking about making sure that you're ovulating and making sure your hormones look fine, but we really want to focus on building the healthiest possible foundation for both you and your future baby. So, first, we need to understand something very foundational, and that's that 70 to 80% of your immune system lives in your gut. So, your gut lining is not just for digestion, but it's actually a barrier. And that's a really important barrier that creates or really builds your immune defense. It's constantly communicating with the rest of your body. So, if your gut is inflamed or infected, full of overgrowth, your immune system is then constantly going to be activated. And fertility really requires a very balanced immune response. Conception is not just about sperm meets egg and you get pregnant. But what needs to happen is that for implantation to take place, it actually requires immune tolerance. And then for pregnancy, it really does require this immune modulation. And your immune system has to know exactly when to defend and when to kind of increase, and then when to allow something to take place by decreasing. But if it's over hyperactive, then the implantation aspect can become very difficult. And if your immune system is always suppressed or too low from these maybe chronic infections, then that could cause some signaling issues to be off. And all of this dysregulation can then absolutely impact your fertility. So let's talk about yeast. Yeast overgrowth, also known as maybe Candida overgrowth, many people have heard of. This is not just going to cause things like bloating, or even vaginal yeast infections, but it can actually increase inflammation levels. It can damage the gut lining. And then what happens is it can create these toxic byproducts that are going to stress out the body. And what's interesting is that your gut bacteria actually help to regulate your estrogen metabolism. So there's a direct connection there. This is what's called the estrobolome. It's this collection of gut bacteria that help to metabolize and even clear your estrogen from the body. So if your gut is in balance, then we have this enzyme called beta glucuronidase that can start to become elevated. And that enzyme is going to reactivate estrogen in the gut so that it continues to get recirculated instead of eliminated. And this is one of the most common reasons for somebody to develop estrogen dominance that I tend to see, at least working with the women in my clinic. And estrogen dominance can be linked to things like heavy periods. You may have more painful periods, PMS symptoms, fibroids, endometriosis, maybe lower progesterone or a shorter luteal phase. So, if estrogen is not being cleared properly, then ovulation can actually become disrupted, and even implantation can really become affected as well. So sometimes if we're seeing endometriosis or maybe painful periods, we need to ask ourselves, is this actually a hormone issue that I'm experiencing? Or could this be something further? Could it be a gut issue that's then contributing to a hormone imbalance? Because the two really are so interconnected, and rarely are doctors putting those pieces together and seeing how it's all connected and addressing that root cause. So, now that we've talked a little bit about yeast overgrowth, let's talk about bacterial overgrowth, which a lot of times is known as dysbiosis. So, when harmful bacteria end up in higher amounts, they can release endotoxins. These endotoxins that bacteria release can actually trigger systemic inflammation. So your ovaries are very, very sensitive to inflammation. So then this chronic inflammation that's occurring can start to impair egg quality. It can disrupt insulin signaling. It can increase your cortisol levels, which is that stress hormone. It can even lower your progesterone levels and then can really increase your miscarriage risk. And on top of all of that, your gut is responsible for absorbing nutrients that are foundational for hormone production. So things like zinc, magnesium, your B vitamins, choline, so many other things. So if your gut lining is inflamed, then it's actually not going to be able to absorb these nutrients properly. And then we can't build these healthy hormones on an inflamed, nutrient depleted gut. So it all gets impacted. Next, let's dive into parasites because parasites are something that are often overlooked. And to be honest, I find them in my patients far more than people want to admit that they're dealing with them. So, when we run stool testing, we actually run a full parasitology report. And parasites can really create two immune system problems. One is where it creates hyperactivity, where the immune system is now constantly fighting this inflammation, or inflammation levels stay elevated because it's constantly fighting the parasites. And then the other one is where we have immune system suppression. That often happens in more of the chronic cases when maybe you've been exposed to parasites for so long that now your immune system is in a suppressed state. So, what's important to know and understand is that a pregnancy actually requires a really important immune system shift. So, if your immune system's out of balance, where it's either overly aggressive or maybe it's very suppressed, then the transition into pregnancy can become more difficult. So, this is why we need to look at the gut because the gut is so intertwined in our immune system, and that immune system is so connected to your chances of getting pregnant and really how you will maintain a healthy pregnancy. So, next up, we're going to dive into is detox. Your liver is what actually processes hormones. Your gut is going to eliminate those hormones. So, if you're somebody who a lot of times is constipated, you're feeling bloated and inflamed, or you have this dysbiosis where we have an imbalance of bacteria, then our estrogen levels can continue to recirculate instead of getting eliminated. And that will really worsen an estrogen dominance situation. So it can disrupt your cycle. It can, if your detox pathways are sluggish going into a pregnancy, then you're somebody who might actually feel a lot worse during your pregnancy. You may have more nausea, more of the morning sickness, more fatigue, more inflammation, even more skin issues. So that's another reason why preparing for your pregnancy is so important, and working on your gut health is key months and months before you ever even start trying to get pregnant, because we can set your pregnancy up for so much more success if we take care of these things. Another really important thing to realize is that your baby is going to inherit their microbiome from you as the mom. So during a vaginal birth, the baby actually gets so much of mom's bacteria, and mom's vaginal bacteria is a direct reflection of their gut microbiome and their gut bacteria, and that microbiome is going to influence the fetal immune programming. So your gut bacteria will help to shape your baby's immune system even before they're ever born, and this will then later in that baby's life impact their risk of allergies, autoimmunity, things like colic, their mood regulation, that gut brain development and connection. It'll impact so much of their health. So it's really important that we're not just focused on getting pregnant, but we're focused on, as women, preparing our bodies, and even as men, to prepare both bodies for a healthy pregnancy so that when conception takes place, the egg and the sperm meet and both are free of oxidative stress or reduced oxidative stress. There's low inflammation levels, from both parties so that the baby ends up having the best chance of having a healthy microbiome and a healthy life and a healthy start to life overall. I love to also educate moms on how going into a pregnancy with things like yeast overgrowth, bacterial imbalance, higher inflammation levels, all of that really does impact how you feel. It is not just luck when you get pregnant and have a good pregnancy, but if you're somebody who wants to avoid the morning sickness, the nausea, the mood swings, the skin flare ups, the fatigue, I mean, while some of that, is going to come with the change of hormones and all the changes that take place during a pregnancy, you really can reduce your chances of having a lot of symptoms during pregnancy if you work on a healthy gut first. And that's because when your gut is healthy going into a pregnancy, then you're going to tend to absorb nutrients better. You're going to regulate inflammation better. You're going to be able to handle the hormonal shifts more smoothly. So, while it doesn't mean or guarantee that your pregnancy will be perfect, it really can just set your body up for more success and make sure that you're more prepared going into the pregnancy so that you could just have a better chance of feeling good in your body and feeling good with all the changes that come throughout a pregnancy. Something that I really recommend couples do prior to trying to get pregnant is running a comprehensive stool test, because while there may not be a crazy parasite going on, it's so important to really look at your microbiome and start to add in changes that you could be doing to actually improve the immune system regulation, improve the state of your microbiome when it comes to bacteria, yeast, parasites, how well you're absorbing nutrients, all of that. Because of how much your gut health plays a role in whether you'll get pregnant, but also how that pregnancy will be, what the pregnancy will look like, and how you'll feel during your pregnancy. It's great to run a stool test to assess your entire microbiome, because if you do run that stool test and you find maybe there's some yeast overgrowth, maybe some bacterial imbalance, parasites, higher levels of inflammation than we'd like, or maybe we're lacking beneficial gut bacteria, or there's damage to the gut lining, then these are things we could really start to address before you start trying to conceive. We can actually clear the overgrowth appropriately with herbs, and a lot of times we don't go and jump right to antibiotics, but we work on herbal support. We can work on rebuilding beneficial bacteria by introducing the right foods, by introducing a good probiotic. We can heal the gut lining, we can optimize detox pathways, balance that immune system. And this is so much easier to do before pregnancy, because once you're pregnant, you can't do a whole lot with changing your gut health if there are infections, because we don't want to be doing that while you're pregnant. It's something that really needs to take place prior to getting pregnant. So remember, fertility is not just about ovaries, it's really about your immune system, making sure your immune system's in a regulated, modulated state, making sure inflammation levels are down, that your detox pathways are optimal and open, that your microbiome is in a balanced state. So if you are somebody who's planning to want to get pregnant in the next year, really now is the time to start looking at your gut health, run the comprehensive stool test, look into how can you actually start to improve your gut health to optimize your chance for getting pregnant, for optimizing what that pregnancy looks like. It doesn't just impact when you get pregnant, if you'll get pregnant, but it really does have such an impact on your baby's health. And there's so many things that we can do if there are things going on with your gut health. Those are things we can do now before you ever do actually get pregnant. So in my next video, we are going to dive a lot deeper into estrogen dominance, something that I mentioned today, but something that is a very common problem and one of the most common roadblocks to getting pregnant for a lot of women. Many of these women experience things like endometriosis, fibroids. While it could be harder to conceive sometimes with the estrogen dominance, there's a lot of things that you can start doing in your day-to-day life on your own to actually start improving the estrogen dominance that your body is dealing with. And So make sure that you hit subscribe so that you don't miss that one, because understanding estrogen dominance could really completely change how you approach your fertility journey and how you get your cycles back on track. So I'll see you in the next video.